All right, welcome and thank you for joining us for our latest Nairobi Ideas Exchange, which is part of Mawazo's Voices PE program. The Nairobi Ideas Exchange is one of Mawazo Voices flagship events, and it invests in getting expert ideas into the public domain. We're excited to be celebrating two things today, both the International Day of Women and Girls in Science, as well as the launch of our Breaking Barriers African Women Innovating on COVID-19 publication. It's an ebook that takes note of and celebrates the work of 14 exemplary women in science and science education, who during the pandemic immeasurably impacted several fields and disciplines. My name is Naliaka Odera, and I'm the Mawazo Institute's content creator and the lead writer of the Breaking Barriers ebook series. Our topic today picks up on this thread of breaking barriers by exploring how African women are innovating in the fight against COVID-19. On our panel today, we're joined by a few of our illustrious Breaking Barriers awardees who have all been instrumental in pushing for and spearheading innovative thinking in their fields in response to COVID-19. We have from Kenya, Dr. Jemimah Njuki, who is the Director for Africa at IFPRI, which is the International Food Policy Research Institute, and the custodian of gender equality and women's empowerment for the United Nations Food Systems Summit of 2021. During the pandemic, Dr. Jemimah's work was crucial in shifting the conversation to include food insecurity in a pandemic, and especially looking through a gendered lens. Next, we're joined by Julia Jenjezwa, who's a proud Zimbabwean engineer, currently working in Tanzania as a design studio coordinator at the Dar es Salaam Institute for Technology's Design Studio. During the pandemic, Julia oversaw several COVID-19 design projects, including the construction of numerous PPEs for vulnerable healthcare workers. And finally, we are joined by Dr. Mercy Korir, who is Kenya's only MD medical journalist and who started Kenya's first health desk at Standard Media to create a dedicated space in news to unpack health and healthcare. During the pandemic, Dr. Mercy dedicated herself to fight against COVID-19 misinformation, both online through her social media and through her various platforms with Standard Media. So we'll start with a panel discussion for the first hour of today and then conclude with questions from our audience. But first, Mawazo Institute has organized a few poll questions for you to answer. So if, Kare, you could take it from here.
Thank you so much, Naliaka. For those of you who may not know me, my name is Kare, and I am the Mawazo Public Engagement Coordinator. And we wanted to, make the panel a little bit informative as well. And so we have some poll questions that should be, testing your knowledge of what you know about International Day of Girls and Women in Science, which is being celebrated today. So our first question, if you could just submit your answers, I'll give us about a minute, is, when was the first International Day of Women and Girls in Science celebrated? Was it in 2010, 2007, or 2016? Our second question, what is the percentage of female researchers in the STEM field globally? So where do you think women are when we look at the STEM field globally? And then our third question is around the percentage of African female researchers in the sub-Saharan region specifically, which does include our lovely panelists. So what percentage of African female researchers do you think are in sub-Saharan Africa? And the last question is around which region in Africa has the highest number of female researchers currently? So International Day of Girls and Women in Science is a UN recognized day that was set aside to empower and encourage girls and women in the sciences. And it was first celebrated on 11th February 2016, which is only, 6 years ago? So 2010 is what a lot of people are estimating might have been when we first celebrated International Day of Girls and Women in Science. This means there's still quite a long ways to go in terms of really making the case for girls and women in science. Our second question is, what is the percentage of female researchers in the STEM field globally? And it looks like the majority of attendees here are correct. It is 30%. And there are some regions in the world where this number is much higher, for instance, in Central Asia and Latin America and the Caribbean. but women overall are underrepresented in the research and innovation pipeline. And we've also seen studies show that women typically receive smaller research grants than their male colleagues. And while they might represent 30% of all researchers, only 12% of women are in national science academies, are members of national science academies, correction. Our third question was the percentage of African female researchers in the sub-Saharan region. Again, here we've got some clever attendees here. The correct answer is B, 31%. So sub-Saharan Africa does fare slightly better than the global average, but still quite a ways to go. And then our last question is, which region in Africa has the highest number of female researchers? The guesses here are around Southern Africa. I have to admit, I also thought it was Southern Africa, but actually Northern Africa has achieved gender parity in research with 45% of female researchers. So Northern Africa is leading the way, and there's still some work to be done among the rest of the continent and in other areas of the world as well. So that's just a kind of quick intro into, what's happening in the state of women in research across the globe and in the region. And I will hand back over to our lovely moderator, Naliaka, to take us through the discussion. Thanks.
All right, thanks so much, Carrie. Okay, so let's get into it. As I said, we have up until about 3 to really get into this discussion. So my first question is for Dr. Jemimah. I remember when I first spoke to you, one of the things that I found so fascinating was, especially with your understanding and your background in food security, there was a lot of predicting that you had to do when it was looking at what was going to happen with COVID-19. So if I could ask you to sort of cast your mind back to that time, early 2020, when you were, doing all of your predictions, what were the major fears of what COVID-19 would do for, the East Africa region or Africa as a whole?
Thank you very much, Naliaka. I think for all those who remember, and I'm sure we all remember when COVID first hit, a lot of the concerns were around health. People were getting sick. There were lots of concerns about treatment, about vaccines, about the number of sick, how the disease was transmitting. And for people working in food security, we actually started thinking about what were going to be the implications on food. And initially, of course, with the disease itself, we sort of was seeing the impact on food far down the line. And so our major concern was also around health of people. But then as soon as government started taking action, as soon as government started dealing with trying to contain the disease, trying to contain the spread, we quickly realized that a lot of the measures that governments were putting up were actually going to have huge implications on food. And in several ways. The first one was just, the countries were closing borders, and there are a lot of countries, actually almost every country, including countries in the Africa region, depend on exchange of food. They're importing and exporting because there's no single country that's producing all the food that it actually needs in terms of the different combinations of foods, whether it's cereals, whether it's vegetables, and so on. So those border closures were our first concern, that there would be countries that would actually be left without enough food if food was not allowed to move across countries. The second big concern was around the number of people, and especially those in Africa that work in the informal sector, where as soon as there were restrictions around movement, as soon as there were restrictions around opening and closing of industry, around closures of markets and public spaces, that we knew a lot of those informal jobs were going to be impacted. So if you think about informal areas in whether it's in Kenya, in Uganda, where households basically spend about 50 to 80% of their income on food. A lot of that income means huge impact on food and nutrition security of people. And there was a huge gender dimension to this, because we recognized also it was a lot of women that are in the informal sector. It's a lot of women who are trading food in markets, and closures of those markets also meant not just lack of access to food, but also lack of access to those income opportunities. For smallholder farmers, because we also, and I also, my organization works a lot with smallholder farmers, it was also, disruptions in input supplies. We depend on a lot of fertilizer that comes from outside of the country, for example, in Kenya, and a lot of those supply routes were closing down. So it wasn't also just an immediate concern, but this was going to have long-term impact on production and productivity. And that actually became our first action. How do we work with governments to make sure that the policy measures that they were taking, that the way they were managing covered that agriculture, food security could be a priority and could be. So at some point, if you recall, in Kenya, even movement of food became one of those essential things that were allowed to move between counties, and at some point even countries had to open their borders to food. So there was a huge policy question around what governments were doing and how to factor in the issues around food into their actions, because without food, really, people were either going to die of COVID-19, or they were going to die of hunger. So we at least needed to make sure that some of those policy actions didn't affect food supplies. But the bigger thing also was the fact that with a lot of those losses in jobs, that we had to work with government to expand social protection, whether those were cash transfers. And social protection in a lot of countries has been earmarked for very vulnerable populations, the elderly, and so on. So even working with governments to see how could they expand social protection to include workers who had lost their jobs. And some countries actually did really well. We saw a huge percentage increase across Africa, for example, on the resources that were earmarked for social protection, including cash transfers, both what we call conditional cash transfers and unconditional cash transfers.
Thank you so much. I'm wondering if you could just further define social protection, and what what that ended up looking like now post the sort of like putting things into place, projecting what could happen. Now on this side of things, what did happen? Was there increased food insecurity, and how were some social protection? How did some of the social protections make it a better situation?
Okay. So in terms of food security, we actually did see increases of food insecurity. We saw slight increases in malnutrition, and especially just of children basically not having enough to eat. A lot of this got manifested not just in absolute food shortages, but in, for example, households reducing the number of meals they had, or food composition. So those that were dependent on vegetables from urban markets, if those vegetables weren't reaching the markets, then they substituted those with more less perishable goods that they could keep in the house, like pulses, beans and things like that. So while the change in actual food security wasn't so drastic, we did see a lot of changes in what families ate and how many times they actually ate. Now, when I talk about social protection, it's it sort of operates on the same principles as basic income would operate, that there are vulnerable members of society for which a basic income, the provision of a basic income is important for their survival, is critical for their survival. And therefore the state has to guarantee that basic income to its citizens who cannot earn that income. And social protection comes in many ways. It comes in form of cash transfers, where government actually transfers cash to households. It comes in form of in-kind transfers, where government can actually have what is called a basic food basket or a basic healthcare package that is then given to households to support them. Some of those cash transfers can be unconditional. Basically, a household receives, in the case of Kenya, 10,000 or $100 or $200 a month, and it is up to them to then buy and purchase the things that they need. And some of the cash transfers can be conditional, that cash transfer is being given for a specific purpose. And in the case of African countries, what we saw is a large increase. We estimated like an 11-fold increase in the resources that countries actually allocated to social protection compared to the pre-pandemic times. So some countries, of course, did much better than others. As you can imagine, there were a lot of competing priorities in terms of beefing up health systems, making sure that families were okay. There are countries where they required people to register. If you lost a job, that you could actually go to a center, register, and then receive a cash transfer. And in other countries, it was really just an expansion of existing cash transfer programs. So for households that they had been already expanding that group of vulnerable people to receive cash transfer. What happened, I think probably the agriculture food security sector had sort of the most immediate response, because as soon as it was clear what the long-term impact of things like border closures, lack of movement of food would bring, a lot of countries, as I said, decided to have exemptions. So food became, when you think about Kenya and the COVID war room, that movement of food became one of the top priorities that the government actually prioritized, saying, those trucks that are moving food from rural areas to urban areas, that they needed to be allowed to move even beyond the restrictive hours. So we had a lot of positive response. But what it also made us realize too is how important, and especially when borders were closed, how important our local food systems are, how important what we call community food systems are. You know, those markets that are in the locality, and how important it was to keep those open, because the negotiations between countries became pretty complex. Getting Uganda to open its borders so that things could move into Kenya and vice versa became political conversations about who had more cases than the other, and so on. And at that time, it was really the local food systems that people relied on. Digital innovations had a huge role to play. That's when you could order things and they get delivered to your house, even when there were restrictions in movement, when people couldn't go to the market, that people could actually, it's when we saw cars line up on the streets, a lot of them out of necessity, when people lost jobs and had to find other means of earning an income, but a lot of it really enhancing local availability of foods in neighborhoods when people couldn't actually move out of their neighborhoods.
Thank you. I think there's more to touch on there in terms of the innovation that was necessary and that came up in the different regions in the food system. So we'll go there a bit later. But for now, I wanted to go to Julia. Julia, I know that from what you told me, Design Studios had already done some work in hospitals before COVID-19 started. But I wondered if you could just give us a rundown of one, what exactly Design Studio is, and then two, what did some of the work look like once the pandemic started?
Well, the Design Studio is a makerspace on the campus of the Dar es Salaam Institute of Technology. Makerspace is a building that is specifically geared towards the advancement or the development of hands-on engineering skills. So really our motto is want to turn ideas into sustainable solutions, and we want to turn students into innovators or into creators, really trying to change from ideas into actual functional prototypes that eventually become functional products. So the Design Studio is a physical space that is equipped with tools and machines like 3D printers and laser cutters, and where students can come in and learn how to use these tools. And also faculty members can also engage to understand how to put in invention education within their existing curricula, like really pushing hands-on learning, pushing problem solving or problem-based learning within the curricula. So towards these goals, within our own education outcomes, the Design Studio, we like to learn by doing. So we take our students out into the community, and one of the places that has been a source of a lot of low-hanging fruit or opportunities for innovation has been local hospitals. So our students were already in hospitals repairing devices, trying to identify ways in which they could meet needs with devices that they could create themselves using the tools and the supplies that we have in the Design Studio. So when COVID-19 hit, I think we found that hospitals were calling back onto us because of this work that we had done in the past, because of the prototyping work, because what they experienced was the closing of supply chains. And all of a sudden, it's very difficult to get a face shield from wherever you're shipping it in from when everyone is keeping it from themselves. I think I share a lot of the feelings that Dr. Jemimah shared about local systems and the importance of local systems, and how the Design Studio in this had to turn into a local system that was responding to the needs. So once the calls started coming in, the Design Studio, first of all, we worked within design. We worked to work with local clinicians within Tanzania to understand their unique needs. Like if it's not just any face shield we would make, what would a face shield specifically for a Tanzanian healthcare worker working at a Tanzanian Mana hospital, and listening to whatever their needs were. And then talking to suppliers and manufacturers, or at least for the beginning, it was just within our Design Studio, identifying how we could leverage the tools that we had, understanding how we could leverage the students that we had who had received this invention education training to ensure that they could actually produce some kind of prototype or iteration. And then over time, we realized that we were working way below capacity. The amount of personal protective equipment that was needed was way more than what we could produce just with our existing prototyping methods. So we actually had to move into a more mass manufacturing space. And really the Design Studio is not originally designed to be that. We're really a place to go from an idea to a first prototype. But because of the needs that had been identified, I think the DIT Design Studio turned into more of a manufacturing space where we had our students coming in and mass producing personal protective equipment from face shields, and also continuing to work on iteration on other devices that could help healthcare workers within their fight against COVID-19. These might be ventilator splitters that they 3D printed. Our students also created a new type of ventilator to kind of meet the medical device supply chain needs. And then finally, towards improving, again, the access to personal protective equipment, we also built an N95 sterilization unit that uses UV rays to sterilize N95 masks so that they can be reused. And by allowing healthcare workers to have increased access to personal protective equipment and protecting themselves. I think this is particularly important, especially in Africa, where we don't have a lot of healthcare workers. We need a lot more healthcare workers than our population would allow. So that makes the access to PPE more so important within the African context, and why it was really essential that we could stand up and meet those needs. One of the other exciting things that came out was the idea of an innovation ecosystem. So the design studio is great at making things and designing and production, but how are we going to identify needs outside of our own network? Because there were needs outside of our network. And within that, we learned very heavily within the Tanzanian innovation ecosystem, where, again, digital products came into play, where we had an online platform where they had identified where hospitals needed personal protective equipment. So we could identify where the greatest needs were and then ensure that we supplied correctly to the right place where the needs were greatest. So that's how the design studio turned from a space for learning, a space for gaining skills, towards, in this time of real strife where we had to meet those supply chain needs, a place where students actually addressed, student engineers really did that full circle of identifying needs within their community, using the skills they're learning in the classroom to practically fabricate a solution, and then distributing that solution to meet the identified need right where the user is.
Thank you so much, Julia. What's interesting from what I'm finding the similarity between those two things is the importance of understanding the local and local needs. Dr. Mercy, a lot of what you're doing is also sort of similarly minded in that the whole purpose behind you creating the health desk was really to be able to talk more about health issues locally and to unpack them for the Kenyan public. If you could you please just tell us a little bit about the importance of the health desk, and then also some of the concept of how the media became so useful and integral in the COVID-19 understanding and the tackling of misinformation and that whole fight, how your role became so much bigger than what a healthcare professional's role can often be at this time.
Before COVID, more often than not, healthcare stories were, as a by the way, behind at the tail end of news or, strips in newspapers. The only time healthcare made headlines was if there is a scandal, somebody is accusing somebody of negligence, or, if the government has stolen money somewhere. Those are the kind of news that made headlines for health news. Otherwise, it was just, just something that is happening before. So even before I came to the newsroom, it wasn't really clear if at all I would add any value to the newsroom, because we don't report healthcare stories or health-related stories as much. But then came COVID-19, and all of a sudden, everyone everywhere is affected in one way or another. They want to know at the very first place, how do I protect my own self, then my family, from this thing? And remember, initially, before even found out what COVID was, there was all manner of information, how it's affecting people. Then we could see stories internationally of how people in the West were being affected, deaths here and there. It was a scary moment for everyone. And so all of a sudden that it became necessary to have a credible source of information, an authoritative source of information, and reliable, in that if we tune in the morning at 6 a.m., is there somebody telling us about COVID-19? If it's at 1 p.m., is there somebody telling us about COVID-19? If you don't understand something, who is that person that we can go to? And so COVID-19, in a way, I usually say, accelerated the need to have, dedicated thematic desks in the newsroom for healthcare, which is where I am. And now if you think about all other spheres of life, then it would be necessary to have dedicated desks. So for myself and that desk, it was, our role mainly was, one, to make sure we are up to date with everything that is happening around COVID. If somebody had come up with a potential new drug that could treat COVID-19, we needed to be on top of that news. If there was progress being made on vaccination, we needed to be on top of that news. If we needed a doctor to come and explain to us some of the symptoms or some of the things that we don't know, then we needed to be in contact and know that doctor and make sure we brought them so that our audiences, our listeners, viewers, readers could have that information. So it became a very important and focal point of getting information, coordinating with other desks, not just on purely the health aspects, but remember COVID and Dr. Njuki highlighted, there was an issue of, do people starve to death or do we protect them from COVID? You know, there was that balance. So we needed to be that focal point that coordinates. When people were looking at, and Julia has said, do these PPEs work? What is the difference between a cloth mask and, you know, a surgical mask and N95, all of this information, does it work for us? We needed to be able to have that information collated in one place and be able to disseminate and be able to contact or be that liaison in the newsroom where people could get the experts, the information. And then most importantly, and we've seen this with social media, and you've mentioned it, misinformation, fake news, and WhatsApp is usually very notorious with that, because in a group, you're 200 of you. Somebody posts a group and then usually starts according to Dr. So-and-so. So the moment you've seen according to Dr. So-and-so, you believe it's the gospel truth. So our role was really to find out, is that Dr. So-and-so actually a doctor? And then unpack everything that they've said so that we're able to, you know, debunk and be able to demystify everything around it. So it became very integral. And for me, as a medical doctor then in the newsroom, it even became even more critical, because not only do I have that medical background, have networks in the medical field, but also when it comes to quick synthesizing and understanding of information and being able to churn out, then I was at a better place to be able to do that, and at a better place to be able to inform and, you know, train the reporters working with me so that we are all on the same page and we are all moving together. So COVID, in a way, helped us to see the importance of health communication, proper health communication, and it's also made us realize the importance of the experts in the healthcare field. You know, we only used to look for them when there was, you know, something groundbreaking, some discovery, but now we needed to know who virologists are, how many you have, how many people are working in the lab, how do these things work, and we needed to know all of them. So it elevated the position of healthcare workers, health experts in the newsroom, and hopefully that's something that we can, you know, keep going even beyond COVID-19. And I think some of the initiatives from Mawazo Institute, even today celebrating African women in science, I think would help us maintain that momentum and, you know, continue keeping and making sure that these professionals, especially women, because there are always very few women being given that chance or very few women coming up, to make sure that they maintain that momentum, they're supported, and more come in, because this is only a start. We never know what else we'll need to tackle tomorrow.
Thank you so much. I'd like to go a little bit further with you, Dr. Mercy. As you said, the health desk is a very important and necessary tool to be able to even just collate some of the stories and to really understand the pandemic and other health problems. One of the things that you'd mentioned in our interview was how in Kenya, we need to not just understand health in terms of, you know, some of the diseases that are out there, but also that we need to understand our healthcare system. And so what are the ways that you feel we can further innovate in the media when we're looking at health and in healthcare itself? What are some of the things that you feel like we're not looking at that we should start looking at?
Sorry, this is something that I've actually been thinking about and wondering, because every year I'm always wondering what else can we do, what different things can we do. And I always say I'm in the business of telling stories. And one of the things that I've realized, and even with COVID, is that different areas different societies perceive and see things differently. The way I understand disease may not necessarily be the way somebody else from, let's say, coastal Kenya would understand, may not be the way somebody in northern Kenya would understand. So my thinking is we need to tell people's stories from their lenses, because then that would help us understand how to improve and, how to change or modify our healthcare systems to suit them. An example, there's a time I was doing a story in Turkana, northern Kenya, and they built this very beautiful hospital, brick, modern, beds and everything. But then, despite doing that, because there's always a need to reduce maternal death, to reduce infant death, but despite having a very beautiful hospital, well equipped and having staff there, women were still not coming to the facility. And so the question was why? So what they did was to do what they call a maternal shelter. And they built it in the way that Turkana people build their homesteads. You've seen those thatch houses, and how they are. So they made the compound where they have the house for the mother, the house for the husband, just like in the homestead setup. And people started coming to hospital. And so you achieve both things in terms of you listen to people, listen to their stories, and you're able to do things according to how those societies, perceive and see things differently. Because culture is one of those things that is really deep-seated, deep-rooted, and you cannot just come one day and, uproot it. So here you've spent a lot of money building a whole facility, but all you needed was a few thousands of shillings, a few thousands of dollars maybe, just to put up a shelter in which, mimics the traditional setup, and you still have your healthcare workers going there, you still have everything within that setup. And so I think one of the things that maybe, I think as a media, we should do, and even the professionals out there, is we need to tell our stories some more, because we see things differently. And solutions can only be tailored towards how we have been nurtured, how we have been raised, the environment in which we are in. So, because the solution that works in Nairobi may not be the same solution that works in Johannesburg. The solution that works in Mombasa may not even be the same solution that works in Kilifi, which is a few kilometers from Mombasa. So the only way we get to know how to tailor solutions to the problems that people have is to hear what those problems are from their own lenses, from their own experiences, and then tailor make to that. So as a media, then our role will be really to amplify those voices in one aspect, and then connect these people to the people with the solutions, the experts, the scientists, because now we will work as that bridge in which, because we are here as, a group that should offer solutions. So we should then be that link, that liaison between the experts, the society, so that at the end of the day, we are weaving together and making, something that is sustainable.
Thank you. That's fantastic. And that was that's a really great example, with the example of what was happening in Turkana as well. Dr. Jemimah, when we spoke, you mentioned the silver lining of COVID being that there was now a space where we were spotlighting some of the weaknesses in food systems, and also looking at things with women. One of the things that that you told me that I've really remembered is that, in rural Kenya, the majority of women there are working the land, are working in agriculture. And yet in Kenya as a whole, women landowners are it's a really tiny percentage. I think it's 4% or something like that. And so that means that there's so many women who are actually not able to be in control of the money that they have. They're not able to be really in control of the labor that they use. So what are the ways that COVID-19 has allowed us to see some of the things, some of the breakages, some of the weaknesses and the problem areas?
I call it a silver lining, but we do know COVID has had devastating impact on our our health systems, our communities, lives have been lost. But one of the things it's also allowed us to see is the inequalities. You know, people kept saying, oh, in this life, we are in the same boat. And it made us realize, actually, we are in the same storm. It's the storm that's the same. But some of us are on boats, others are on yachts, others are on, on canoes. And it's really shown us some of the inequalities that exist within our societies. You know, the fact that even when our health systems were really overwhelmed, that a lot of our poor couldn't access them, especially those in rural areas. That when children could not go to school, the burden of care fell disproportionately on women. And therefore, it compromised their ability to earn income in addition to the pandemic itself playing a role in that. It made us realize that it's a majority of our women who were in the informal sector. And so they lost a lot of jobs. It confined women in spaces where abuse was running amok. Got girls out of school that we saw the largest increases in teenage pregnancies that we've seen and not just in Kenya, but in the region. But it also sort of made us realize what the cracks in our systems are, including some of the issues that Dr. Korir is talking about, the cracks in our health systems. Government started realizing it's not just enough to talk about economic growth. They have to think about who is being left behind with that economic growth, and how do we actually provide social protection? How do we provide? I remember even our government started talking about, and this is something that we as a country hadn't really sat down and thought about, but we started talking about what's the minimum expenditure basket for a family, depending on a family size, because even so, the social protection that the government had been giving was things like 2,000 shillings per family, irrespective of what the size of that family is. And they realized with the pandemic that even that amount of money was so inadequate that we started calculations of what's that minimum expenditure basket for a family. And they actually went back and revised the amount of funding that was going to families, where it was 2,000 got topped up with about 5,000 to make it at least 7,000 shillings a month, because that is what was really adequate to keep a family, medium-sized family alive during the pandemic. So there's a lot of these inequalities, and what we really are hoping for, especially as researchers working with governments, is that we carry forward these lessons, that it's not enough in Kenya for Aga Khan Hospital to have the best facilities. We can all go out and brag about that, but that even those rural hospitals, those hospitals in the counties, those hospitals in the sub-counties, that they have to have the adequate number of doctors, equipment to take care of people. So there's a lot of inequalities that we have that sort of have been brought much to the fore, that became general conversation, whereas it was a lot of women's rights organizations that had been talking about gender-based violence. The scale of it made it it became a national concern, basically, whereas it's a lot of women who are talking about unpaid care work. It became a national conversation that we need to reduce and redistribute the unpaid care work that is borne by women, whereas water was the business of the Ministry of Water. It became the business of the Ministry of Health, because then the ministry, there has to be enough water in households for households to be able to wash their hands and keep their hygiene that was needed. So I'm really hoping, at least where I sit as Director for Africa at IFPRI, working with governments across the continent, that these issues even after the pandemic, because we're just another couple of years away from another pandemic. And we really have to learn some of these lessons and take them forward. From a research perspective, we've also learned, it's been very interesting because we couldn't go to the field for a long time. So like for 1.5 years as researchers, we couldn't get out and do research. So we started relying more on technology, and we started realizing the disparities in technology, especially across regions between urban areas and rural areas, the disparities even in just phone ownership between men and women, that when we needed to talk to women in households, a lot of them didn't have the phones. And so we were relying on the one household phone, and there's issues of privacy. It's not like you're gonna ask somebody whether they're being beaten and they say, yes, I'm being beaten, but the person doing the beating is sitting next to them. So even in the way we do research has also changed a lot. And our hope is that some of these lessons actually become lessons for us to improve our systems going forward. Investments in our local food systems, investments in how food is sold in markets. For the first time, we saw governors going into markets and measuring steps of where people should be and realizing actually our infrastructure is not adequate. So we're hoping those sort of start pushing governments to more what we call pro-poor policies that actually focus on the poor within countries, on those in the informal sector, on those in rural areas.
Thank you so much. Before we go to a question for Julia, Dr. Mercy, I'm aware that you need to leave us shortly. So I wondered if I could just fit in one quick question for you. Given that today is the International Day of Women and Girls in Science, what does gender equity look like for you and for your field?
Okay, so for my field, medicine in the country, I think, okay, when I started medical school, that was in 2006, we were almost 50-50 between male and female. But I understand that now the skills are tipping and we have slightly more women, slightly more girls than boys in medical school. So I hope that translates later on, because after the field, some people change altogether and go do other things. So I hope that translates entirely to the length of somebody's profession in the science field. But then when I look at and just quickly think about some of the key health institutions or research institutions, some are headed by women, and it's women who are driving the conversations around it. Top of my head, if I think of DNDi, that's headed by a woman in the African region. KEMRI, some of the top researchers at the Kenya Medical Research Institute are women. KEMRI at the headquarters or in Kilifi, some of the key people are women. It's been a long time coming. We still have a long way to go, but at least we are now starting to see more women coming up, more women being celebrated. My role, and that's one of the things that I have decided I'll do, is to tell more stories of women in some of these fields, because as a young girl growing up, if you do not see somebody like you doing something that you ever want to do, then you may not think it's possible. You may not be inspired to think that that is possible. So as I said, I'm in the business of telling stories. So we need more stories of the women who have made it there, for them to be an inspiration, for them to be role models, for those young ones coming behind them, so that we bridge that gap, so that we are 50-50. I don't believe in there being more women than men, because there is a reason why in society we have men and women. So there has to be that balance for equity. And we see that in areas where women are part of the conversations, women are part of the people making the decisions on the table, we see that even the decisions, the policies are friendlier. as opposed to when it's men only. I forget what the name of that study was, but there was one where they see that in societies where women are in leadership, societies where even in government or in institutions, you find that they are more environmentally friendly, they are greener, and they are more prosperous. So I believe that we need that balance. We need to have as many women as possible on the table. So I think we are at 50-50 as it is now, but we need to do more in terms of having more women out here publicly filling those spaces, because we may be 50-50 on paper, but if we are not hearing those voices, if we are not seeing them, then we may not feel the impact as much as it should be, and we may not have that sustainable impact where we have, generations after generations coming, so that these women who've made it have somebody to hand over the baton to.
Thank you so much, Dr. Mercy, for your time and for the participation in this panel, and also for your participation in our ebook. Thank you so much.
Thank you. Thank you very much. Sorry, I couldn't stay on for too long, but thank you for inviting me. It's an honor to be here. Thank you.
It's been great being with you in the panel, Dr. Korir, and I do hope you get to link with us to share more of our stories and others out there.
I'm in the business of telling stories, so I'd be happy to do that. Dr. Njuki, Julia, it's a pleasure to meet you, Naliaka and the team. Thank you for having me.
All right, so over to you, Julia. Sorry, it's been a while, but one of the things that is so interesting with the work that you're doing at Did Design, and how you talked about essentially falling into a system where now suddenly you're mass producing large quantities of things that you never expected to do, was some of the conversation we had about P's intellectual properties and navigating the systems within the country to be able to trademark some of your products. And so my question to you is, what are the things that are necessary to allow for innovation in your field to happen? What is the alchemy that needs to happen for you? And maybe you can touch on your experience in Tanzania and possibly your understanding of how things are in Zimbabwe as well.
One question I love to ask people is, think about everything you're wearing right now. Where was it made? Think of the water bottles we're drinking from. Where was that made? One frightening thing we realize as Africans is a lot of the products that we use, we wear, we interact with on a daily basis are not made in Africa. And a lot of the time are not made with African experiences in mind. And similar to how, I think the one silver lining within the manufacturing or engineering sector, to borrow from Dr. Jemimah's framework, has been realizing how little manufacturing there is in Africa, how few products we make. And it goes from something as small as a water bottle or a head wrap all the way to medical device development. If you were to ask all of our hospitals how many medical devices are created with African hospitals, African systems, our power cuts, our skin color, all of these ideas in mind, it would be very frightening to realize that so little is actually made within our context. So one thing that I think the COVID-19 situation highlighted was we need more manufacturing within Africa. And when we have the importation, when we have those supply chains cut off, and we have to rely only on what we make ourselves, the reality is very frightening. And when we now look at why is that the reason, because I teach at a university, we have no problem with innovation or innovators within the continent. There are wonderful people coming up with lots of ideas every day, but those ideas are not going towards commercialization. So we see there's a gap happening here. There is, ideation or coming up with ideas, and then there's commercialization where product is now inside a market. And that middle part in the middle is called translation or product translation, how a device goes from a prototype to a product. The translation process or the translation pipeline within a lot of African countries is very unclear for African innovators. And it comes in a lot of things, like, do our institutions, our universities have good intellectual property policies that protect our students, still get money back to the universities and ensure sustainability of the universities, and also still perpetuate innovation. There's a way in which universities can take all the IP, and that disincentivizes innovation. And also that students need to rely on the institutional power that universities have in order to propel this. So that's one thing that I really think about is how are we enabling, we're thinking about the alchemy. If we look at any country that has done very well within manufacturing and local design, Singapore, China, Germany, universities or institutions of higher learning are critical for research and development. How are we investing within our local universities? How are we ensuring that the institutions are capable of moving that research into actionable products, systems, processes, and policies in the real world? Are our own policymakers reading our research? When we come to another part of translation, we're coming away from intellectual property even to regulation. If you're going to make any product, it has to be regulated, it has to be certified. Do our local regulators understand how to assess our devices with our own context in mind? Are they able to test them and to give them that certification? And the experience that I have found, though anecdotal, has been that that's not the case. It's, you bring something new, and the very idea that, I have made something, I'm bringing it to you, I want you to mass manufacture this, or I want you to just put a sticker on it that says it works so that I can sell it. That entire idea is completely new to a lot of our regulators. So where is the gap that we're meeting where our regulators are very good at importation of devices? And I've been told by regulators, well, if you have an idea, send it to China, get it mass manufactured in China, and then the process is really easy when you need to import it back. Because that process we know very well. We know very well how to import a product. But how do we know how to assess a product for local manufacturing? Especially when we're thinking about what Dr. Njuki said, that if in a few years we're going to be in this situation again. Are we going to have locally made ventilators? Are we going to have locally made mass-produced face shields? Are we already creating the systems right now in order to empower mass manufacturing? I don't know there are many innovations that are coming out of the universities. One that might make ventilation redundant. And this goes even as far as vaccination. There's a lot of talk of, I think it's intuitive within Africans that the things that we are receiving are not made with us in mind. And I feel that most strongly when we talk about the COVID vaccine, where there's so much distrust about COVID vaccines and this desire for local vaccines. Has it been tested on Africans? Could we manufacture, our own vaccine? And my question is, can we manufacture our own syringes? That's where we are. That's where our production potential is. So I think the alchemy is multilateral. We need to think about our systems of higher education. Are they capable of empowering our young people who are learning with practical skills, with the idea to use that critical thinking to synthesize problems? And, the same way a problem is different in Turkana or Mombasa, do our students understand how to distinguish that? Do they understand how to, our engineers being taught or any of our students being taught to research and to understand the users, African users within their production? Are universities capable of having intellectual property laws or guidelines that protect and encourage innovation? Are governments investing in innovation policies that ensure that innovations grow, that regulators understand local manufacturing? And then finally, do we have manufacturing potential? I think one of the first challenges that we had is our design for a face shield was a plastic visor. And we went to a plastics manufacturer and we said, please, can you make this for us? And they said, we don't do that. We get the mold straight from the national company outside of Tanzania, and then we make that. This idea of local innovation and local things being made here, we just won't do. So where are you going to mass produce that plastic? We had to switch our entire design, even though it was what was appropriate, because we just did not have the mass manufacturing capacity. So truly, I feel like we're in such a precarious position when it comes to manufacturing, when it comes to production, or just the generation of our own products that affirm our experiences. I think that alchemy will have to come at all of these levels within the system.
Actually, what you talked about students and their capacity to innovate lends itself well to a question that somebody has asked here by Victoria Leonard. She says, Dr. Jenjezwa, as an educator, how did you lead students to think and create innovatively in a context where regulatory support was minimal? Asante sana for your work and leadership.
I think one thing that is super powerful about being African is that the potential for impact is really great. I think when you train a student how to understand power, what they can then do is fix an incubator that will help a baby. Like, the stakes are higher, but also that means that the potential for impact is higher. I think one thing that I try to draw from within the students is, we call it creative confidence. I try to impart the idea of creative confidence within any of my students. The idea that, you can do it and you can make an impact within your society. And also trying to pull them away from moments where they are afraid. Because with our students, I don't create any of the problems that they solve. They go with me to the hospitals. They go inside the wards with me. They identify the problems by themselves, and then they create the solution with me as a guide. So by being able to show them very clearly, this is the potential for impact that exists with the very skills that you have, it makes the rest of the educational process really easy when they can understand that these skills are not theoretical skills or another problem set, another math problem that you have to solve to get the engineering degree, but you understand the math problem so that when you want to do something for impact, you can apply the math problem to actually save a life, change a life, make a difference.
Powerful words at the end there, especially. Thank you so much, Julia. Dr. Jemimah, a question for you. I believe this was from someone called Margaret. You talked about cash being sent to people affected by COVID-19, for example, those who lost jobs. Currently, the Kenyan government is using the cash model to reach out to those affected by drought instead of distributing physical food. But how can they be sure that the money gets to the right hands? For example, I mean the man of the house. I mean so that the man of the house does not just spend the money on beer. So essentially, how can they be sure that the money is getting in the right hands?
I think context matters. It's one of the conversations where we need a lot of nuance. So some of our early research actually shows that when cash transfers are targeted to women, that you see much bigger impact on things like children's nutrition, on education, and other important household outcomes. But in other cases, you don't see that. You don't see cash transfers being targeted at women having those kinds of impact. And a lot of it has to do with social norms around household provisioning. And there are cases where we've actually seen targeting cash transfers directly at women and not other household can actually lead to increased cases of what we call intimate partner violence. And that's why I'm saying this conversation is particularly nuanced, because if you do that kind of targeting of cash transfers, it then needs to be accompanied by additional interventions around household decision-making, around how to prioritize interventions and how to prioritize expenditure. Interestingly, for Kenya, I was just looking at the data in terms, because they did do a tracking of what proportion of the cash transfers were actually being used for food. And the data currently shows about 1% of the cash transfers that were provided were actually going to food, irrespective of who was receiving the cash. So I think let's also not really jump. It's very easy to say, you know, men will get the money and drink it. But let's also start thinking that those men live within those households, those are their families. They do have a responsibility, especially within our cultural context, as what you call providers of and heads of households. So there's a lot of nuance when we talk about what really works for cash transfers and what some of the impacts of cash transfers can be. What has been very, very useful is ensuring that those cash transfers are actually accompanied by reinforcing messages around gender equality, about shared decision making, about how to utilize funds for families. But as I said, we do have earlier evidence that showed, and especially in Asia and Southeast Asia, cash transfers targeted to women having much bigger impact on nutrition and education of children. But that needs to happen within a cultural context where norms are also changing. More norms around women's decision-making are also changing. Norms around shared, and especially around shared decision-making within families, are also getting much more egalitarian and more, acceptable as in general. So from research, we've seen really mixed results depending on whether you target cash transfers to men, to households. But what has been consistent is that it's not just enough to give the cash transfer, that you've really got to accompany this with much more broader messaging around shared decision-making, gender equality within the household, the importance of really prioritizing the household for cash transfers.
Thank you so much, Dr. Jemimah. For Julia, I'm going to put sort of two questions together. The first question was wondering sort of hypothetically if some of these issues in terms of barriers for some of these products to be accessed by the local person, if it's not a byproduct of politicization, essentially, and wondering about maybe turning more into towards like the private sector, I suppose. And the second question is, the work that you're doing occupies an innovative space, one that isn't exactly formally embedded in the university, but fills a particular gap there. What other opportunities are there for improving manufacturing that may be more tangential?
I'm not convinced that it really is just about, I think that would be very, very simple to call it just it's a political affair. And sadly, because of how translation works, the government has to be part of the process. Any device, even if it's a cell phone to a foodstuff, if you make a coconut oil bottle, that's going to be regulated by the government. The government has to assess it, ensure that it's safe and approved for use. So we can't run away from the government nature or the government within this, or the national problem solvers. I think there's definitely so much impact within the private sector. And one thing that I've seen or experienced is that the private sector is really quick to suck up these ideas in a faster way than I think the public sector might be. And they understand, I think, the merit. I think the idea of explaining the merit of manufacturing and the merit of local production, the merit of developing local talent is, I found more easy to explain, I think, within the private sector. And we do work within the private sector. People outsource private sector, like private sector outsources research and development to our students. I think the gap that still exists is the value of African research and development. Because if you're working in any other country, if you ask a university to conduct research and development for you, you would pay them. But the question is, I think we can value our young students, we can value our higher institutions, but that value also has to translate in ensuring that they have adequate resources in order to move that forward. So I think that we cannot run away from having our leaders be part of this conversation. I think they are critical. And I think decisions being made at that level can fast track things in a really quickly way. And I also think that the private sector has its own very specific role within this, particularly within funding, within, I think, developing young entrepreneurs. You know, in 2050, most people in the world are going to be African. Like if you throw a rock, it's most likely that that person is going to be African. But do we have enough jobs for all of these Africans? I don't think we have enough jobs. So there's a need for us to start even more businesses. And how are we encouraging the development of the employers of the future? So I would say that I think the politics we cannot run away from, and are critical to the conversation of the translation of products. And then in terms of the design studio, well, I think the model that the RISE 360 Institute for Global Work, who I work for, who push invention and education across Africa, we are embedded within the university ecosystem. So we're inside the university ecosystem, quite clearly tried within that. But I think we are just one example of what could be the norm in every engineering university, the norm of what could be at any educational institution. And there are also spaces like ours that are outside of higher educational institutions. And I think we also need to rethink the higher learning academic institution, particularly in Africa, where so many people are historically excluded from that space. How can we make our institutions of higher learning more open to other people coming in? Because there's a wealth of knowledge that people who may not have received formal training can also benefit from. So I was speaking to the design studio. We are open to anyone. I tell people I've taught computer-aided design to an accountant. If anyone wants to learn to 3D print, we have a 1-hour course. We're open to anyone, and anyone can come in and learn. But I definitely do share the challenge that these spaces are too few and too niche for something that I think is quite basic in higher learning education, and something that really can impact the resilience of a community, of a country in the times of crisis, like our COVID-19 response work has done.
Thank you so much. I'm looking at the time, so I want to ask one more question to both of you. It's the same question that I concluded with Dr. Mercy with. So essentially, given that today is the International Day of Women and Girls in Science, what would gender equity look like for you and for your field? So maybe Dr. Jemimah, you can start us off with that.
Thanks, Naliaka. I think in the sector, what we've seen over the last few years is actually we've got more women getting into agriculture and food systems. Even as we were growing up in rural areas, actually our objective was to go to school, go to university, never have to farm, never have to work in agriculture. So we've seen that perception slowly changing. Part of it has been, seeing, young girls also seeing people like us and us seeing the ones that came before us having successful careers in agriculture, in food systems. So that perception has been changing a lot. One of the things that we would, of course, like to see what happens is when at undergraduate level, diploma level, you start seeing really, like large numbers of young women and girls going into science. And then as you go up to PhD level, these numbers start going down. As you go to the postdoctoral level, even less. As you start going higher up into scientists and so on, that number becomes less. So we call it this leaky pipeline that we need to close so that women, and especially young women, stay in science. So a couple of things that I think are really important. At the moment, I work in agricultural sciences. just about 25% of us, and especially at the PhD and above level, are women. About 30% maybe, but then when you start going into the research leadership, only 1 in 7 of research leaders are women in Africa. So we need to get more women in leadership. One of the things that I started last year and launched at the UN Food Systems Summit was something we're calling Global Food 50-50. And this is an index that's actually tracking food systems organizations and how well they're doing with respect to gender equality, including in leadership positions. So we are hoping that this index actually makes organizations accountable both for women's leadership, but it's not just enough to have women in leadership. We need policies that actually work for them. So if we want more women in those organizations, the policies must work for them. There has to be parental leave policies, policies against sexual harassment, policies against discrimination in promotion. So that environment itself has to be enabling for women, because we don't want women to survive in science, because there's a lot of organizations where it's a survival. Your antennas are always up. So we want women to thrive in science, not to just survive. So we are also looking at really the organizational setup and how that culture, it can't be a cutthroat culture of the longer one works, the more you become a recognized scientist, because we know women are also balancing a lot of other things. So we've got to make our working environment conducive. So that's why we have this huge focus on the organizations themselves, because part of the reason why women leave science has to do with that environment and how conducive or unconducive it is. The third thing that really would signify equity, at least from where I stand, is when we remove all these social barriers to women being in science and in leadership. It's about how society perceives women. I want to be able to stand in front of people and be seen as a credible scientist in my own right, based on the work that I do, and not first people viewing me as a woman, and therefore can sometimes diminish my contributions or what I do. So there's a whole societal shift, and it's been changing. There's been a lot of progress. People like me and Julia, and others, we're much more recognized in the spaces we are in, but there's still a lot to be done in terms of that societal shift and how all these social barriers. It's things like unpaid care work. How do we recognize and redistribute it? Because as women, we still have to balance between bearing children and advancing our careers. So some of those barriers, we still have a long way to go in terms of addressing them. But first and foremost, we want to see women in leadership. I usually say, if we are saying 50% of our populations are women, 50% of the labor, and even more that's going into food production is women. Wherever you go up that system, we should be seeing 50%. Even that 30% is not acceptable, actually, because if there were no barriers, we should be able to see that percentage maintaining across the different species.
Thank you so much, Dr. Jemimah. Women should thrive and not just survive. Got it. Julia, same question to you. What does gender equity look like for you?
I am definitely from the engineering sector. Definitely I'm one of those people who have been with their antennas up consistently. I don't share, I think, the experience of my fellow panelists. I'm used to being the only X in the room, the only woman, the only Black person, the only African, one of 2 girls in physics in high school, only mechanical engineering, Black woman, mechanical engineering graduate in university my year. So I feel very visceral, even now as an educator, There are 30% women at a large engineering university where I teach. So I think the engineering sector has leaps and bounds more to go within gender parity. I think what that would look like is definitely having more policies to protect women, because our antennas are up and we need some, knowing that there are systems in place to protect us when things go wrong is definitely very helpful. One thing that's very critical to me, but might seem very small, is access to personal protective equipment for engineers that fits women. That's a very small but really damaging thing. All the welding tables are made for men who are quite tall, and you can see so many things within the entire system, really tiny nuances that tell you that, you know, this system is not made for you. So I would like to see a hammer that can fit in my hand, and hammers made knowing that there are people of different sizes and abilities and genders that will be holding these tools and wearing this PPE. So creating a space within engineering where women are seen and heard. And then finally, I think the idea of retention, ensuring that we retain women. So I think I would love to come to a place where, like Dr. Jemimah, people see the work first. They see what the evidence that I'm bringing to the table, and not just what this phenotype and the stereotypes that this phenotype carries are coming into the room. And then I have a little challenge to anyone within the room who hires, and I want to challenge us to hire returnees to the workplace. I think women leave and sometimes have to, you know, do childbearing, but then they have excellent skills, they have excellent knowledge. So I would like to challenge anyone who does hiring on this panel to give a second look to women who have gaps in their resume, gaps where they've taken time to do some of the most important work, which is wearing the youth. So that'll be it from me.
I mean, that's a powerful challenge. Yeah, hire returnees. That's very apt and important. I hope that that resonates with someone. So let's wrap it up here. Firstly, I'd like to thank our panelists for their time and the thoughtful perspectives that they gave us on what innovation looks like in their fields and what could inspire more future for the continent. We'd also like to say a big thank you to each of the women who are included in our Breaking Barriers, African Women Innovating on COVID-19 ebook, which is now available on Mawazo's social media and on Mawazo's website, and is actually, we've included a link to the publication in our chat right here, so you can click on it and go through it now. So the women in the book are Dr. Penny Moore, Dr. Mariam Amour, Mara Chibwana, Dr. Jemimah Njuki, Julia Jenjezwa, Dr. Linda Kalilani Piri, Yariwo Kitiyo, Dr. Mercy Korir, Dr. Jennifer Mabuko Maroa, Shima Mohammed, Dr. Esther Ngumbi, Huria Tegali, Dr. Sachwaelo, and Akona Shangela. And they hail from South Africa to Botswana, to Tanzania, to Kenya, and finally Egypt, all of whom have worked tirelessly through the pandemic in hospitals and labs and out in the field to advance our global understanding of COVID-19 and all of the ways it impacts us. I'd like to give a special mention to the Mawazo team behind the publication, which includes myself, our graphic designer and creative advisor, Arafa Hamadi, our digital media and public engagement consultant, Karim Mugo, our communications manager, Frida Wanjiku, and our content creator, Wanjiku Mungai. We encourage you to find your copy of the Breaking Barriers, African Women Innovating in COVID-19 ebook today, pour through it, and learn more about how African women are impacting global efforts to rally against COVID-19. Thanks once again to our delightful panelists. You can find Dr. Mercy Korir at KTN News and in The Standard, and online on Twitter and on Instagram with the handle at Dr. Mercy Korir. Julia Jenjezwa with the DIT Design Studio in Tanzania and online at juliajenjezwa.com, and Dr. Jemimah Njuki with IFPRI and online on Twitter at Jemimah_Njuki. So thanks once more to all of you, and we look forward to seeing you at the next Nairobi Ideas Exchange event. So thank you, everyone.
Thank you so much for having us, Naliaka.
Thank you for a lovely session. Take care.
Thanks all.